And at Stanford, they did this close proximity analysis of encounters in a school, because schools are known to have kids who fall ill. Kids falling ill gets their teachers infected. The teachers getting infected infects others, so on and so forth. So then you have the diffusion of the disease across a population, and the idea was, can we actually model and create models of human contact networks? And the idea of these human contact networks then allowed me to think about something called reverse 911. For those of you who have been in the US, 911 is when you call for emergency medical service. But reverse 911 says, we're going to call you because we think you've been exposed to a disease, and we'd like for you to go in to the hospital to get checked out, because we know you've been in close proximity to somebody who's been infected. So this idea of reverse 911 connects to this idea of sensing and human contact networks. So these three examples, the smart pill bottle, smart inhaler, and human contact networks, each one of them uses sensors, but then combines it with this idea of learning about people and their behaviors to have value from a societal standpoint. The last example is really a caution about using people and their behaviors in this sort of manner. So you probably have all heard of Google flu trends, which is the idea that people, when they fall ill, search on Google about things that they feel they're ill with, and sometimes scare the heck out of themselves. But if you take these search queries on Google and you aggregate them, Google felt, and actually accurately did predict for a while, 2 weeks ahead of the Centers for Disease Control, when the flu was propagating throughout the country. Now, it turned out that for a variety of reasons, that Google flu trends started missing its mark quite badly by not being an accurate predictor of of flu. And the reasons for that happening was that the kind of search queries people were searching for on Google began to change, because Google made some changes in terms of how you could search for health-related issues. This doesn't render very well. It looks awesome on my computer. But the main point about this that I wanted to make was that you need to be careful about thinking about how people and their behaviors being captured via these kinds of sensors, how they might act, what kind of causal interpretations can you make from them. This work by David Laser from Northeastern basically demonstrated that Google flu trends in and of itself was in error. The CDC data in and of itself was also not good enough, but when you combine the two, they actually did better than either one of them did. So plain old Google flu trends now is being combined with CDC data, which also goes back to the issue of open data policy that I talked about, which is the sharing of private data with public data sources to provide sources that are of even greater value. Okay, so I've given you three examples of systems that bring sensing, reasoning, and decision making together. And in each one of these, from urban analytics to health analytics to mobility, they each have these elements coming together to address big societal challenges. What are some of the key issues that arise in designing these systems? The big challenge really is ensuring privacy. In every one of these examples, there is the potential for having very detailed, granular data about people and their behaviors, and one needs to really be careful about the kind of privacy protection one affords to individuals. The second is that as more and more of these systems are being deployed, so if you have driverless vehicles and intelligent transportation systems, they are vulnerable to security attacks. So security and privacy become really important considerations in the design of these cyber-physical social systems. And I'm going to leave you with a set of aspirational use cases that can be brought about by cyber-physical social systems. The first one talks about how we might integrate genomic, biomedical, clinical, and scientific data to predict onset of diseases. and identify unwanted drug interactions. The second aspirational use case is how one might be able to combine data from a variety of sensors to reduce traffic congestion and generate significant savings both in time and fuel costs. In every one of these aspirational examples, I've alluded to how we are addressing this in our own work. And the third is being able to, one perhaps particularly relevant to what Chennai has been through in the last month, to be able to more accurately predict natural disasters such as hurricanes and tornadoes, so that we can employ life-saving and preventative measures. And the last one is by correlating disparate data streams, being able to really enhance public safety. So as you think of these different examples that allow you to bring these elements of sensing, reasoning, and decision making together, I want to start with leave you with the first example I began with, which is about the driverless car, and how various technologies in the driverless car have the potential, even if the full driverless car is not going to be reality in the near future, there are going to be many attendant kinds of elements of that technology that are going to have immediate societal benefits in terms of saving lives. And since we are at an Institute of Technology, I thought I should leave you with this idea about the built infrastructure, safe and sustainable spaces, and then since we are at an educational institution, there's a huge transformation happening in the field of education about using the same kind of sensing, reasoning, and decision making to transform education with a focus on learning outcomes, to making education much more available to larger numbers of people, and allowing for a great many people that perhaps couldn't get into an IIT or couldn't be at a Carnegie Mellon to get the benefits of an IIT and a CMU education. And I know you all will join me in in subscribing to this idea that Don Tapscott pointed out, which is that the key idea is to foster an environment that encourages students to imagine and think broadly and collaborate and capture serendipity, as well as the freedom to take risks and create. And I was earlier today with Professor Nagarajan and his point about the great degree of entrepreneurship here at IIT that's being exhibited by students, and this is a great theme to close this talk on. I want to thank you again for your attention and for this opportunity to share some ideas with you about both my work and that of my colleagues. So thank you again.
Thank you, sir, for your wonderful lecture. I think your insights on mobility, urban analytics, and health analytics would be very interesting for all of us. And you made it seem very interesting, the whole data science and data analytics part. Thank you so much. We will now have the closing remarks from Dr. Bhaskar Ramamurthy.
Sure, you'll all agree with me that what we heard was a very insightful lecture into where we are heading in this brave new world where you have this huge amount of data. Data can tell you the right things, data can tell you the wrong things. And we all have to figure out how to use this data, particularly data from multiple sources, linked by context, and extract from it information in real time that can be very valuable to address many of the challenges. In particular in India, and he alluded to this, if you look at what the smart cities efforts ought to be, I think we have in our cities major challenges with regard to almost all the important services, whether it's water, whether it's electricity, transportation, healthcare, and so on, and education. And one of the common themes in all these challenges in the Indian context is the mismatch between demand and supply. And a lot of the times, the actions that we take as independent actors as consumers is to take various actions that will minimize the probability or the risk of us not getting the service that we need. So if we had a lot of expense we go through in order to do this, take the context of water, if you take any of the homes in Chennai, you can afford it, you have multiple levels of storage, and it's all because there's some uncertainty in the water supply. If you take transportation, people take out their vehicles and drive even in this congestion because they're unsure about public transport, the comfort level, the availability, the timeliness, and so on. In a lot of these situations, real-time information flows can make all the difference between one decision and another. And by appropriate, and he showed about the example of the lottery and so on, by appropriate combination of incentives and pricing structures and so on, and policies in other words, and systems that are where the information flow is in the city is global, and you get very accurate information about what is feasible, and you get you get services that are offered to you in a certain way, then it's possible to use this kind of these kind of network information flows and analysis of data in real time to actually, for example, incentivize and entice more people to go towards public transport and rely less on private transport. So and so on. I don't have time to get into this, but these are areas in which we are also working at IIT Madras and beginning to work. But they are complex, and the context in which these kind of ideas can solve problems is different. For example, in the West and in the Indian context, as I said, we are mostly grappling with the demand and supply situation. And but there's tremendous potential, and we should be grateful that we had this really insightful lecture into how people are thinking about these new tools and new methods in different parts of the world, and we have to learn from this. We have to engage as part of this global process of learning and research, but we have to learn how to apply it in our context to solve our problems. So thank you, Krishnan, and we hope you'll continue to be engaged with our institute and with others in India who are working on these kinds of problems. Solution for many of our really daunting challenges lies in taking these routes. So thank you very much.
Thank you, sir. I would like Dr. Ramaya Krishnan to present a memento to Dr. Bhaskar Ramamurthy. Now Dr. Bhaskar Ramamurthy will present memento to Dr. R. Nagarajan, Dean IR, and Mr. K. Suresh. We are now to the end of the program, but before we move on, I would extend my vote of thanks. It is a privilege and great joy for me to extend vote of thanks to our director of IIT Madras, Dr. Bhaskar Ramamurthy, for his support to host this event at our beautiful campus and for gracing this award function with his presence. I am also grateful to Dr. R. Nagarajan, Dean International and Alumni Relations, and Mr. K. Suresh for extending their support in contributing to the success of this event. I would also like to thank Dr. Ramaya Krishnan for making it to this function. It was a pleasure having you come here all the way from USA, sir. Thank you so much. My gratitude is extended to all the staff of Central Leather Research Institute, faculty of Adi Shankara College of Engineering and Technology, Guduru, Andhra Pradesh, and the staff of Department of Management Studies, IIT Madras. I would also like to thank the audience for your presence here and making this event a grand success. Thank you so much, everyone.
I would like Dr. Ramaya Krishnan sir to just present a small memento to Amrita by conducting this proceedings.